Lexi Todd, and this is my case study number 3. So, a little bit about this client. He is age 5 years old. He is diagnosed with autism spectrum disorder, um, level 1 autism. I would say he started as a level 2 when he had first started in this setting due to having some higher magnitude behaviors, such as self interest behaviors, and those have gone away completely. We don't see those anymore. And he also had some higher aggressions. Every once in a while, he still has some higher, or he still has aggressions, but they are at a much lower frequency. So with him, he had never been in a restrictive environment before. So he has never been in a clinic setting, a school setting, nothing. So he doesn't really know any other environment except at home. So in general, the clinic setting was a huge transition for him. For this case study, the behavior of concern was increasing his communication, specifically labeling items. So with him, his language was very different. So he had a lot of language. You might not always be able to tell what exactly he's saying all the time, like a novel therapist probably wouldn't know. But he had a lot of language. He would have multiple words. He would say sentences, but then when you would go to prompt him with something, like if he didn't know the name of something or exactly what he wanted, he couldn't always say it, or he would revert to one word. So, for example, if you would say, like if he would just say, I want to go to the big room. And for some reason, maybe you wanted to prompt him, can I? Just for example, he would shorten it to go or big room. Um, so he also would rarely label items. So it would be a lot of this, that, give me, things like that. He didn't know a lot of names of things. So we wanted to increase his communication and then also increase his ability to be more descriptive when asking for items rather than saying want, mine, that, or this, anything like that. So for this intervention and stimulus class, we wanted to increase his language and his ability to label items, and we wanted him to eventually learn how to tact just common items in general. So we started with common items like chair, bed, cup, things like that. For this example, we're using chair. The interventions utilized were discrete trial teaching with matching, listener responding, and tact trials. For the stimulus class, it was furniture. So we wanted to just be able for him to label the item first. And then eventually we moved on to the feature, function, and class of the item. So it's all furniture. You sit on it. It has a seat, legs, things like that. But for this specific intervention, we just wanted him to label these items. So just interventions and derived stimulus relations, a little bit continued. So there are 3 types of derived stimulus relations. So reflectivity, symmetry, and transivity. So with reflectivity, or also known as identical match. So we started with matching. So in this relation, we taught identical matching trials of pictures. So identical pictures of a chair, A to A, same exact picture. Match, match chair, match. So then once that was mastered, we moved on to symmetry. So another way to say this is a two-way relationship. So A to B, B to A. Um, so we did the listener responding trial. So we did show me the chair. I started in a field size of 3 to start. He eventually expanded. He is at a field size of 6, but this was very new in his ABA journey. So we started with 3. The other 2 pictures included I had another type of chair in there, like a couch or something like a desk chair, and then the other one was just a distractor. So I'd say, hey, show me the chair. Yeah, that's the chair. I would also try to transfer it eventually in that moment, like, hey, what is this chair? And just kind of worked through a lot of showing me these items first. Um, and then once that was mastered, we moved on to transitivity, so tacting the items. So we are very naturalistic based. So specifically at my center, I had done in the lunchroom, we have table and chairs. So just naturally, I had, the therapist would say, hey, what is this? And then if he would say chair, that would mean he has met that transitivity. So A equals B and A equals C in that instance. If he, which he did, but if he met all of these, that would mean stimulus equivalence has been met. So this is when the learner demonstrates all stimulus relations because he was not directly taught how to label the chair. We taught him in the other trials of the matching listener responding. Then we went to labeling these items. And eventually we got on very quickly, and we didn't have to necessarily do this with every single item. But just to start with those common items, that's kind of where we started with our intervention. This learner specifically, I feel like fit this concept for the case study, especially because his language was so different, and we wanted to increase that language and increase his tacting even just naturally in the environment. So yeah, that's my presentation. Thanks for listening.